Hello, everyone, and good morning, and welcome to the Montgomery Heart and Wellness Nutritional Tips segment. And as we talked about Tuesday, those of you who may just be tuning in, every Tuesday and Thursday, we have nutritional tips with recipes on Tuesdays and nutritional tips on Thursday mornings. We tend to air these around 11 o'clock Central Time, and this is good information. We're getting a number of requests from our patients and some of our wellness members with questions about nutritional tips and recipes. So we decided to look in our files and air some of these tips. So today we're going to be talking about nutritional tips to help prevent or perhaps even reverse renal failure. So stay tuned.
Hi everyone, my name is Veronica James. I'm a nutritionist at Montgomery Heart and Wellness. Now this week we're going to be talking about kidney failure or kidney disease and how, as it relates to nutrition. This first portion is breaking your fast. So our action of the week, which is just a simple general tip that I recommend people who are going through kidney failure or kidney disease or who are working on preventing kidney disease to do. And one of those things is avoiding the amount of acidic food that you consume on a regular basis. Now you want to make sure that your pH levels are balanced, and by doing that, you want to make sure that you consume a high amount of alkaline food items. What does that mean exactly? Fruits, vegetables, things that are plant-based, which is what we've been talking about. So making sure that you consume that. Studies have shown that consuming alkaline foods that are rich in fruits and vegetables can aid and reduce stress when it comes to dealing with kidney disease and kidney failure. And later on, we'll talk about how stress and even sometimes depression plays a role in this. Now, foods to avoid. One of those things happens to be a breakfast Danish. Now, the reason I said a breakfast Danish is because in breakfast time, many cases, it's very easy to grab something that's around your workplace, or if it's at home laying around, and it may be just a simple sugary substance. However, a single Danish for breakfast usually consists about 231 calories, and it's loaded with trans fats and saturated fats. According to the American Heart Association, trans fats are generally hidden in many baked goods. So if you notice that your baked good contain hydrated oils or even a little amount of vegetable oils, it is still considered a trans fat, which is horrible when it comes to heart disease and kidney disease. And the reason why I'm saying both is because in some cases, many cases actually, people who are diagnosed with kidney disease have some heart issues that are going along too, and sometimes they have both. So a substitution for that, we recommend for you to do a cherry breakfast Danish. And this is what Marissa is making in her food demo. So go check it out. Now the nutritional benefits we're going to look at for today is cherries. And cherries are filled with antioxidants and phytochemicals that are used to protect the heart. So you want to make sure that you can add a good amount of some cherries in whatever dish that you're making for breakfast, as well as a dessert. High blood pressure is a common symptom in kidney disease, and cherries contain a particular high concentration of a flavanol, which improves blood flows and blood pressure. Now we're also going to look at the nutritional benefits of blackberries. Now blackberries contain vitamin C, which is what we've been talking about before, which aids in protecting your immune system and illnesses and infections, which is very important, especially when you are diagnosed with kidney disease and you're having to do dialysis. When consuming foods while on dialysis, you want to choose foods that are rich in nutrients such as vitamin C, vitamin E, and B1 and B2, and blackberries contain that. Blackberries also contain a certain amount of fiber, which can be used to keep you full, and which is very important because in many cases, patients that have to deal with dialysis generally lose a loss of appetite. So you want to make sure that you're containing a large amount of blackberries, foods that are pretty high in fiber to keep you full and nourished. So our nutritional summary for today, we're looking at action steps, which is adding additional alkaline foods into your regimen, meaning fruits and vegetables, obviously. Foods to avoid, breakfast Danish, or really pretty much any baked sweet good that is store-bought, as well as looking at the nutritional benefits of cherries and blackberries. Thanks. Have a great day.
Okay, I hope that was helpful to you. And for those of you who want more information and more support or want to learn more about our programs, you can go to our site on Montgomery Heart and Wellness. That's MontgomeryHeartandWellness.com is our main website. We also have support materials online. That's an online bootcamp class. That's online.montgomeryheart.com. For general questions, you can email us at wellness@montgomeryheart.com about any material you see online. And of course, the online bootcamp have key features. It's a medically designed program. It's medically safe. And there's group support as well as expert support. So, and also tune in on our other shows. Monday night, we have Fresh, Natural, and Live, along with myself, along with some expert health providers who are excellent in helping you learn how to reverse disease naturally. So until then, continue to live beyond the script, and we'll see you later on.